Hi, my name is Sarah O'Flynn. I work for Save the Children, and within READY, my role is to provide technical expertise in nutrition. I contributed to this framework by focusing on the integration of nutrition approaches, including ways to support, protect, and empower key populations such as pregnant women, mothers, infants, and children. So, how will this framework help you? To answer that, let's focus on a scenario. Your organization decides to respond to the COVID-19 pandemic. Specifically, you aim to provide aid to people that voluntarily or involuntarily reside in community isolation centers or quarantine facilities. In this scenario, if my role is to design services at a quarantine facility or a community isolation center, I have the opportunity to design a response that holistically considers community and individual needs. From a nutrition perspective, a holistic approach is critical to mitigate the drivers of malnutrition, such as food insecurity or illness, as well as to facilitate the most efficient response. With that in mind, I would start by using the integrated framework for ideas at the planning stage. I would find examples of cross-sectoral coordination. This could include partnering on joint assessments with other organizations to support the inclusion of the unique needs of pregnant women, mothers, infants, and children. I would use the framework for examples from other responses and other sectors on designing interventions. Integration activities include cross-training staff and leveraging existing patient interactions to increase early identification of nutritional risk through use of simple screening tools and the design of referral systems. I could also find ways to work with other sectors to ensure information is delivered to patients efficiently. It is also critical that throughout an outbreak response, we help all sectors identify ways to protect, support, and listen for the needs of mothers, infants, and young children. In particular, we need all actors to prevent the separation of mothers and their infants throughout outbreak response, and to consider the combined needs of the mother-infant pair in the design of quarantine and isolation interventions. If separation is required by public health authorities, mothers and families will need a multi-sectoral approach to support them during isolation or quarantine and upon reuniting with their infants, particularly as it relates to infant feeding. An integrated response provides the best opportunity to identify, refer, and act on risks faced by populations such as pregnant or breastfeeding women, infants, and young children. These are just a few examples of the help and resources you can find in the integrated framework. The framework provides ideas, examples from around the world, and technical references to the latest guidance. We hope the framework will help you in organizing holistic services, and we look forward to hearing your examples of integration. Thank you.